But in that time, I've realized that emergency medicine is a great job, and of course there are good things and bad things about every job. We've all been there where we've experienced the most amazing shift, where we've saved a life, where we got that wow feeling, that high five moment, where we know we've just made the biggest difference to a patient and that patient's family. We've given them the greatest gift that you can. We've saved their life. And there is no feeling like that. And we all know what that feeling is. But at the same time, we have those situations where we're faced with the access block, the busy shift, where you don't have time for a drink or a meal or a pee, where yours is the only car in the car park in the middle of the night, compared with the other consultants. And you're trying to get things done, and you're faced with what I call sequential distraction, which is where you start to look at an x-ray that the interns asked you to view, but then the nurse in charge says you need to go and see the guy in bed 6, and then the admitting phone rings, and then a consultant from another specialty comes and wants to complain to you about something. And you never really claw your way back. And this tends to be punctuated by that final irritating step of a nurse slapping an ECG in your face, which is the optimal way to stop all cognitive processes. And I tend to find when this happens that I feel like I can't remember what I started doing in the first place, and I feel like I'm inside some kind of nested series of Russian dolls, and I've got to get out of them to go back to whatever that first job was. So there are tough things about our job, we all know that, but I still think it's a great job. And there probably is no perfect job. I used to think being an astronaut would be pretty cool, but I've since learned that it's not all spacewalks and medals, and in fact it's not uncommon for their fingernails to fall off. So I wouldn't fancy that. Now I'm going to give you a bit of awesome now with the first story, and this is when I was working on call as a retrieval consultant. I do a bit of retrieval medicine. And there was a bloke called Andy who was an emergency registrar doing a retrieval term. Now Andy had gone off to a peripheral hospital to retrieve a young man in his 20s who had a diagnosis of septic shock due to pneumonia. And Andy calls me, and the conversation's something like this. He says, I'm near this guy, he's really sick, he's on quad strength adrenaline and noradrenaline, he's mottled, we can't move him. Every time we try to put him onto the retrieval stretcher, he loses his output. He's not going to survive the retrieval to Sydney. Okay, well, any other options, Andy? What have you thought of? I've done an ultrasound of his heart. Excellent. What does it show? I don't know how to do ultrasound. Okay, but I've MMS'd you the images. Well, cool, Andy. What do you think it shows? I think it probably shows tamponade. Well, you're right. You've done a good parasternal long axis there. There's right ventricular diastolic collapse. There's pericardial fluid. Excellent. I thought it was tamponade. I'm ready to do a pericardiocentesis. I haven't done one before, but I'm pretty sure I know what to do. I've got the equipment ready. With your say-so, I'll crack on. By all means, it sounds like a good idea. So Andy aspirates a pretty large volume of straw-colored fluid, and before they leave that hospital, that guy is off all vasoactive drugs. He's pink. He has a normal blood pressure, which is why Andy looked like this immediately after the procedure. Now, that was really cool, and what he showed there was really what emergency medicine's all about. He wasn't going to let that patient die. He wasn't going to be held back by a lack of a certificate of competence in ultrasound. It wasn't going to be held back by the lack of other specialists that could come and bail him out. He took responsibility, he owned that resuscitation, and he made things happen. That was awesome. And I think Andy there showed something of the spirit of emergency medicine.